So ketamine is an anesthetic originally. So we think of it in terms of going into the hospital, right, and getting ketamine to sedate us, or on the battlefields, right, when you're dealing with wounded soldiers. But over time, it's been come to be used as a psychedelic. Under certain dosages in the right setting, you actually can have a psychedelic experience. When we're working with ketamine with our patients, we could just experience a more open setting where their defense mechanisms are lowered and they're really able to be more authentic and true to what they might not say and be able to say, we could say, in a general setting. But when you start to get into higher dosages, we're having a much more internal experience. So ketamine is approved by the FDA to be used for treatment-resistant depression and treatment-resistant PTSD. Anything outside of that is considered an off-label use, but that doesn't mean that we're not seeing the same incredible outcomes. So in my practice, we're using it for OCD, eating disorder, anxiety, trauma. We're using it for pretty much the majority of the things that come through the door that people have been sort of running the gamut of trying to get treatment for years and not being able to see that symptom reduction piece. The concept of using the medicine is to access your inner healer, but we don't all allow that to be accessed, right? We're very safeguarded about that. That's a vulnerable position. And so it can be very difficult for people to get to the point where they're actually able to use the treatment to their advantage. Getting into this at the ground level, getting into ketamine, getting into psychedelics, when it's all happening, it's all erupting, is incredibly exciting, but it's also very challenging because I'm saturated around clinicians that are all excited about this movement. We're all talking about it, but there isn't patients lined up outside the door to come in because they don't know about it. It's sort of when cannabis became legal, it took years to even call it medicine. It's the same transformation that needs to happen. We're in here, we're ready, we believe in it, and we're excited, but we need time for society to catch up.